Hi, I'm Dr. John Six, Vice President of Medical Affairs and Chief Medical Officer of Washington Health System. Today, we're at Washington Health System, Washington Hospital, and I'm going to show you some of the additional safety measures that we've implemented to keep you and your family safe. Don't put your health on hold. Come on inside. So as we're walking in, please make note of the stickers that we have placed on the floor every 6 feet throughout the health system to promote social distancing. Come on inside. So we're here now at the check-in and greeter desk with Rebecca, and I'm going to check in.
Hi, I'm Rebecca. Welcome to Washington Health Systems.
Thank you.
Where are you headed to today?
I'm going to get some labs drawn.
Okay, very good. And what was your first name?
John.
And last name is?
Six.
Okay. 5. All right, I'm just going to have you put this on the front of you here, okay?
Thank you.
And then I'm going to give you a number so that when you have a seat, they can get you back to registration. And I'll send you over to Mary right now, and she'll get your temperature and screen you for coronavirus and everything, okay?
Thank you, Rebecca.
You're welcome. Thank you.
Hello.
Hello.
I'm Mary. I'm just going to go
Hi,
over a
Mary.
few questions
Sure.
and screen you. Hi, John. What's your last name?
Six.
Okay. Have you been out of the country or traveled out of the country in the last 14 days?
I have not.
Have you been exposed to anybody that's had confirmed COVID?
No.
And have you been tested for COVID?
No, I have not.
Fever, cough, congestion, runny nose, or shortness of breath?
No.
Okay, we're just going to take a quick temperature. Doesn't have to touch your skin. 97.3, that's perfect. And we're going to get you into registration.
Okay. Thank you.
Thank you. Have a good day.
Thanks. Bye-bye. So as you'll notice here, we've spaced the chairs for social distancing purposes as I sit here and wait to go back for registration.
Number 41.
Hi.
Hi.
So what are you here for today?
I'm here to get labs done.
Okay. And what is your name?
John, 6. So here we're in the registration area, and you'll notice that each patient has their own registration room. In addition, we'll have hand sanitizer in each room for the staff and patients, and we have disinfectant wipes that will be used to clean all surfaces before and after each patient encounter. So now I'm going to continue with the check-in process. Thank you. So a touchless check-in process. Thank you, and I'll head down. So right now, we're going to walk upstairs to Cardiac Diagnostics, and we're going to show you what it's like to go through a stress test. We also have hand sanitizer throughout the facility, and we'll wait here to go upstairs. So here we are at Cardiac Diagnostics. We're going to walk down the hall and show you what it's like to have a stress test and the safety measures that we have in place. Come on. So here we're going to show you a typical waiting room. We just happen to be on Cardiac Diagnostics. You'll notice we have signage throughout the facility and the health system that promotes and encourages social distancing. Where we do not have formal stickers, we'll have lines every 6 feet to promote social distancing. And if you come on inside, in a typical waiting room, we'll have the chairs spaced at least 6 feet apart. So we'll have minimum patients in here at any one given time, again, to promote social distancing. And all of this is in order to keep you and your family safe.
Hi, I'm Lorraine Flores. I'm from Environmental Services, and I'm going to show you the precautions that we take during the COVID-19. So we wipe down throughout the day periodically all the elevator buttons inside and out. We wipe down the handrails. We wipe down any handles to any doors. If there's a light switch, we'll wipe down the light switches. We even wipe down the hand sanitizer dispenser. And as we wipe it down, we do open it up and check and make sure all of them are full and ready to go.
We're here with Nurse Roxanne, who's going to walk us through some of the additional safety measures. Roxanne?
Hi. We like to get the patients directly from the nuclear medicine department into the stress room and try to avoid the waiting room as much as possible to promote social distancing. Whenever we bring them in, the patients who have not been tested for the coronavirus or have tested positive for the coronavirus, we only do a medication stress test on them, and we just have them sit on the edge of the stretcher. And the medicine test is the pharmacological nuclear stress test. Then if a patient would like to walk on the treadmill, we need for them to have the coronavirus test done, and it has to come back not detected, which is negative, for them to exercise on the treadmill. Between each patient, we do wipe down all of our equipment with our disinfectant wipes.
So thank you for joining me today as we did a quick and brief review of the safety measures that we've implemented here across the health system. So this includes both the Washington Hospital, Washington Health System Green, and the WPG, which is our physician group. It is safe to seek care, and don't put your health on hold. Come visit us. Thank you.